So pulse field ablation is a new technique for performing catheter ablation for atrial fibrillation. And this works by giving very, very short, very high voltage electrical pulses to the heart cells around the catheter. And this is the way this works is that causes the heart cells themselves to overactivate and then essentially get replaced by fibrous cells. Now, the great thing about this is, although heart cells are very sensitive to this, it doesn't actually affect other cells in the body. So it doesn't damage, for example, nerves or the swallowing tube, or at least in the voltages that we use during the heart procedures, those damaging effects outside the heart itself are very unusual. So it's potentially even safer than some of the other treatments that we have. So in classic thermal ablation methods, we're using either heat induced by an electrical current at the end of the catheter, or by freezing to actually essentially burn the heart tissue. And that isn't very tissue selective, so that burn will, if you, for example, give too much burning energy, that will damage tissue around the heart. So of course we've had a huge amount of experience with that, and we know how to control that burning energy. But let's just say with pulse field ablation, we have a bit of a larger safety margin. So I think that's why we'll see patients having benefits from these new technologies. Yeah, so there are two, I guess, big advantages. Number one, that it's another layer of safety for the procedure, and really that means that the procedure can get a little bit less stressful, I think, for the team in the room. It also allows us to get maybe slightly more efficient than we've been. But to be honest, the biggest effect that I've seen from the biggest benefit for the patients has been these two things. Number one, it seems to be even more reliable than the old methods. And number two, the patient doesn't feel too much in the way of pain after the procedure. So people seem to be feeling really well, able to go home, feeling pretty good pretty quickly after. There is a disadvantage though, and that's that we have to do these procedures under general anesthesia. And if we don't, while we're administering the therapy, it can be too painful. So in my private cases, I do all my procedures under general anesthesia anyway, but I know in the NHS it can be a little bit harder to get hold of general anesthesia for these procedures. Yeah, so it's a great question. What type of arrhythmias can these treat? Well, potentially any arrhythmia could be treated by one form of pulse field ablation. However, the technologies have been really developed for atrial fibrillation, and right now I think it's only atrial fibrillation that's really being tackled routinely with pulse field ablation. Although these procedures are super safe, being safe does not mean risk-free. And so if we're undergoing any cardiac procedure, of course, there's going to be some risk. Thankfully, these are super small, but there's still that risk of bleeding around the heart, bleeding when we put tubes in the top of the leg. Both of those can be real hassles, and very rarely people can even need operations to fix that. If, for example, there's a whole cause. Or the really severe things that, for example, damaging the heart valves or damaging the swallowing tube or damaging the nerves, these, I suppose, they're still there. They're still possible to happen, but we haven't seen that with these technologies. So I think all the physical risks still remain, but the energy risks probably are ameliorated a bit with new pulse field ablation technologies.